There really wasn't, prior to 2009, much funding at all for gun violence prevention research. There are centers springing up all across the country, and we're part of that movement to really understand firearms, even just the epidemiology of firearm injury. We don't really fully understand the full extent of the problem. The data sources that we have are all are incomplete and not linked. And so it's really, we're still kind of at, if you have training in public health, we're at that beginning part of the stage where we're really trying to understand the problem still, because you can't really respond to a problem until you understand it. Primarily research projects. We do have one or two public health practice projects, which means it's like a actually project that has impacts in the world in real time, versus research, which is more reflective. The Gun Violence Review Commission in Multnomah County is a fatality review commission. We have representatives from, I think, 25 organizations on our review team who reviews 1 to 2 gun violence cases per month. This is interpersonal violence. So we're not looking at self-harm cases yet, or unintentional injuries yet. We receive reports from the Portland Police Bureau, or Gresham Police Department, Multnomah County Sheriff, and we write a case summary, and all of our partners add to that summary. So it's a holistic view of these deaths that occur in Multnomah County from interpersonal firearm violence. So we have this review team who reviews the cases. They make recommendations on how to prevent future gun violence. Those recommendations are then presented to an implementation team, which is composed of change makers. People with lived experience of gun violence sit on our implementation team as well. That was actually a request from our review team. And they implement recommendations. We currently have 4 work groups that are seeking to implement recommendations related to preventing future firearm violence. One is working with the Oregon Liquor and Cannabis Commission. One is working with the Bureau of Alcohol, Tobacco, Firearms, and Explosives to reduce straw purchases or illegal purchases of firearms. One addresses housing, and another one is working in schools and promoting community services in schools and organizations that really do on the ground work preventing gun violence, working and kind of trying to integrate that group of people into schools. So those 4 recommendations we're currently implementing in work groups. These are all upstream factors that influence gun violence. They're the root causes of gun violence. Like, for example, it might be hard to think about how housing is related to gun violence. I think if you ask someone who has lived experience of gun violence, they know the hot spots and know that there are low-income housing and other housing complexes that actually are breeding grounds for gun violence. So it's kind of making those links in this public health approach to gun violence prevention. We don't see this as a gun rights versus non-gun rights issue. That's not where we sit in this space. We're really looking to prevent injuries and finding places where, first just to understand the problem and understand what's working in different areas of gun violence and firearm injury prevention. I think that public health typically has this interorganizational, interagency collaboration. Because public health does look at human health as very holistic, that it's not just high blood pressure, and going into the clinic and if you have high blood pressure, that most of health happens outside of the clinic. And the way we, and like everything that we do affects our health. So it's the chemicals in our rug. It's the water we drink. It's the house that we live in. It's the access to nature that we have. It's how safe our communities are. The list goes on and on. So in order to address all these different factors, we have to think about who can help us address those factors. You have to have everyone work together in order to improve human health.